3 out of 4 American men living with HIV don't know it until it's almost too late. I'm Dr. Jame, a US-based HIV researcher and counselor with 20 years helping men protect their health. I've heard the same words too many times. Doc, I wish I'd known sooner. This isn't about fear. It's about awareness. HIV today is manageable, but only if you act early. Waiting lets the virus work in silence while you push through fatigue. Early action changes the outcome. In this video, I'll reveal 5 early warning signs most men overlook, explain why they're ignored, and show what to do the moment you notice one. My goal is simple. Clear, no judgment guidance so you can make smart choices. Before we go deeper, help me understand what you need. Tell me your biggest concern. Testing, privacy, cost, or talking to a partner in a comment right now below, please. If you're not ready to say it publicly, type any number from 1 to 9. That tells me you're here, you care, and you want real answers. I'll use your feedback to shape the next videos so they speak directly to your life. Subscribe for practical updates that respect your time. Part 1. The core problem and solution. The real danger for American men isn't just HIV itself, it's silence. Every year, thousands of men contract the virus and don't know it because they mistake the symptoms for stress, exhaustion, or aging. That quiet delay gives HIV the advantage. It grows stronger while your immune system weakens. All because no one ever told you what to look for. The risk isn't only to your health, it's to your family's security and the future you're working hard to build. But here's the solution. Get tested early and treat it early. A simple private HIV test at your local Walgreens, CVS, or health clinic takes less than 20 minutes. It costs less than a dinner out, and the result gives you power, knowledge. If it's negative, you know you're safe. If it's positive, you start treatment immediately, often with just 1 pill a day. Within months, your viral load can drop to undetectable, which means you can't transmit HIV to anyone else. That's the benefit. Peace of mind, protection for your partner, and a second chance at control. Modern medicine has turned what used to be a death sentence into a manageable condition. Men who test early live long, strong, normal lives. They keep working, raising families, and pursuing dreams without fear or stigma. I've seen it with my own patients. When they take action, they regain not only their health, but their confidence. So why wait? Pride doesn't make you strong. Prevention does. Every day you delay gives the virus time to spread, while one simple step could stop it cold. You owe it to yourself and to the people who depend on you. Being responsible doesn't make you weak. It makes you the kind of man your family can count on. We've faced the hard truth and the clear solution. Now, let me show you what happens when a man waits too long to act. Marcus from Houston learned this the hard way, and his story might sound more familiar than you think. Part 2. Real American Stories and 5 Missed Symptoms. The best way to protect yourself and your family is simple. Get tested early and pay attention to what your body is trying to tell you. This isn't about being paranoid. It's about being prepared. When men take the initiative, they discover the truth before the virus can do serious damage. One small action can completely change the course of your life. Now, let's look at what happens when that step comes too late. Marcus, a construction foreman from Houston, was 32, married with 2 young kids. A strong, proud man who worked long hours and never complained. For 8 months, he ignored every sign that something was wrong. His story represents thousands of American men who think they're too tough to get sick. At first, Marcus felt constantly tired. "Doc," he told me, "I thought it was just the Texas heat." He was sleeping 10 hours a night and still dragging himself through the day. That's not normal exhaustion. It's extreme fatigue, one of the earliest red flags of HIV. The immune system is fighting around the clock, draining your body's energy faster than you can replace it. Then came the weight loss, 18 pounds in 6 weeks. Marcus thought he was finally getting back in shape. What was really happening was his immune system burning calories non-stop as it battled infection. That's unexplained weight loss, another sign most men dismiss. Soon he began catching small infections, colds, mouth sores, and skin rashes that wouldn't heal. "I figured it was stress," he said. "But that's how HIV weakens your body. It quietly breaks your defenses, making you vulnerable to things that never used to bother you." By month 6, he woke up soaked in sweat almost every night. He changed his pajamas twice before morning. He blamed it on pressure from work. But night sweats and recurring fevers mean your body's immune system is on fire, fighting something serious. Finally, he noticed swollen lymph nodes in his neck, under his arms, in his groin. He thought it was from working out too hard. In reality, his lymph system was full of infection. When he finally came in for a checkup, the test confirmed what his body had been shouting for months. Here's what changed everything. Marcus got tested at a Walgreens clinic. 20 minutes, $40, and full privacy. That test didn't just diagnose him, it saved him. Because he caught it before it was too late, treatment brought his viral load to undetectable in under 6 months. Today, Marcus is strong, healthy, and raising his kids with more awareness than ever before. His wife tested negative. His story proves one thing. The earlier you act, the easier it is to win. That's the benefit. When you act fast, you stay in control. You protect your partner, your career, and your peace of mind. Waiting doesn't build strength, it builds risk. And once you understand that, it changes how you see health. Real masculinity isn't ignoring pain, it's facing the truth and protecting what matters most. If Marcus's story hit close to home, I'd like you to do something right now. Think about the part that spoke to you most. Maybe the fatigue, the weight loss, or the moment he finally got tested. Type a single word that captures what you're thinking into the comments. If you feel this message reached you, share it with one man who needs it. And if you believe I can improve these messages to serve you better, simply comment the number 0. That tells me to refine, rebuild, and deliver exactly what you need next. Next, I'll show you exactly how American healthcare makes testing easier than most men think, and how simple it is to take that first step toward peace of mind. Part 3: The Solution and Healthcare Reality. I'm Dr. Jame, and here's a clear path men in the United States can follow today. Step 1: Decide to know your status. Uncertainty burns more energy than the truth. Step 2: Pick the fastest testing option that fits your life. Walk-in clinics at CVS Minute Clinic and Walgreens provide private HIV screening in about 20 minutes. Planned Parenthood offers sliding scale services and respectful counseling. County and city health departments run free or low-cost clinics. If transportation is hard, ask about at-home test kits by mail. For hospital-based care, large systems make it easy. In the Northeast, Johns Hopkins Medicine in Baltimore and Mass General Brigham in Boston have strong infectious disease programs. In the Midwest, Mayo Clinic and Cleveland Clinic offer comprehensive HIV services. In the South, Emory Healthcare in Atlanta and Houston Methodist are reliable. On the West Coast, UCLA Health and UCSF Health are excellent. Wherever you live, search HIV clinic with your city and look for clinics tied to academic centers or your health department. What should you expect when you arrive? A quick conversation about symptoms and risks, a finger stick or small blood draw, and a clear explanation of results. If your test is negative, ask about prevention, condoms, safer sex strategies, and whether PrEP fits your situation. If your test is positive, breathe. You are not alone, and you are not a danger to your family when you start treatment. Modern antiretroviral therapy is powerful, well-tolerated, and often just one pill a day. Here's what happens after a positive result. The clinic confirms the test, draws baseline labs, and often starts treatment the same day. Baseline labs include CD4, viral load, kidney and liver function, tests for other infections, and sometimes a genotype to guide medication. In my practice, men who start early reach undetectable within months. Undetectable equals untransmittable, or U equal sign U, means you do not pass the virus to sexual partners. That fact rebuilds trust and lowers anxiety at home. Worried about cost? Under the Affordable Care Act, many plans cover HIV screening as preventive care. If you're uninsured or underinsured, ask about the Ryan White HIV/AIDS program and the AIDS Drug Assistance Program. These programs help pay for visits, labs, and medication. Health departments can guide you through applications in one visit. For insured patients, most plans cover modern regimens with modest copays. Pharmacies can apply manufacturer assistance or coupons. If money is tight, tell your clinic up front. There is almost always a path. What about privacy? Clinics follow federal HIPAA rules. You choose who knows your status. When men ask me whether employers will find out, I explain that medical information stays between you and your care team unless you share it. If you need time off for appointments, most workplaces accept simple doctor notes without details. Your job is to take care of your health. Your employer's job is not to judge. Let's talk about the first month on treatment, because routine matters. Set a phone alarm, tie the pill to a daily habit, after brushing teeth or with breakfast, and keep a small pill case in your work bag. If side effects appear, call the clinic. Don't tough it out or stop on your own. Today's medications have alternatives. The goal is adherence without misery. Missing a dose happens. Get back on track quickly and tell your team if barriers repeat. Shift work, travel, or stress at home. Now, bring your partner into the plan. When men involve their partners early, trust grows. Schedule testing for both of you. If your partner is negative, discuss PrEP with the clinician. It's a strong layer of protection while your viral load drops. If you're single, protect future relationships by learning how to explain you in plain language. My treatment keeps the virus undetectable, which means I can't pass it to you. That clarity replaces fear with confidence and honesty. Finally, aim beyond control. Aim for a stronger life. Sleep, nutrition, exercise, and mental health strengthen your immune system and your relationships. Lift weights 2 to 3 times weekly, walk daily, and eat meals with lean protein, vegetables, whole grains, and water. Limit alcohol, get 7 to 8 hours of sleep, and use simple stress tools. Breathing drills, short breaks, prayer, journaling, or a quick call with a friend. Therapy or men's groups turn fear into action. Health is the base that lets you work, love, and lead. You've just seen how approachable the system can be when you know where to start. If you've been waiting for a sign to act, this is it. Choose a place, your nearest clinic, pharmacy, or a hospital program, and put a test on your calendar today. Next, we'll tackle the fears that still hold men back: job security, insurance, and family conversations, and turn them into concrete steps you can use this week. Part 4. Overcoming fears. The biggest obstacle for most men isn't the virus, it's fear. Fear of losing a job, fear of judgment, fear that life will never feel normal again. These fears keep good men silent, and silence is what gives HIV its power. I'm Dr. Jame, and I've seen hundreds of men stand where you are now, nervous, uncertain, trying to decide whether to tell someone or hide it. Let's break these fears down one by one and show you what's actually true. First comes the fear of job loss. Many men worry that once they're diagnosed, they'll be labeled or replaced. But under the Americans with Disabilities Act, your employer cannot legally fire you because of HIV. Your medical information is private by federal law. If you need time off for appointments, you can provide a simple doctor's note without revealing details. I've written hundreds of these notes. None ever mention HIV. What employers want is reliability, not your diagnosis. When you take care of your health, you perform better, and that's what matters most. Next is the fear of insurance problems. I hear this every week. Doc, my insurance will drop me. The reality, the Affordable Care Act prevents insurers from denying coverage for pre-existing conditions, including HIV. Medicaid expansion in most states covers testing and treatment. For those without insurance, the Ryan White program fills the gap, covering visits, labs, and medication. I've watched patients go from terrified to relieved when they realize they won't lose financial protection. Another deep fear is family judgment. Many men imagine rejection, but times have changed. With proper treatment, you can live a full, healthy life and protect your loved ones. When your viral load becomes undetectable, you cannot transmit HIV. You = you. That fact alone turns shame into empowerment. Education replaces stigma. I've seen couples grow closer because honesty builds trust. Children raised in truth learn compassion, not fear. Now, let's talk about the benefit of facing these fears. The moment you stop running from them, you gain control. You rebuild self-respect. Health follows responsibility. Men who engage in care early live decades longer than those who wait. Their energy returns. Their focus sharpens. Relationships improve because secrets no longer poison daily life. Imagine waking up without anxiety, knowing you've done the right thing for yourself and the people counting on you. That's the real reward, peace and strength. Why must you act now? Because hesitation steals options. Every day you delay, the virus replicates. Every day you ignore symptoms, stress compounds. Action stops that spiral. Think of it like construction work. The longer you ignore a crack in the foundation, the costlier the repair. Early testing and treatment are the tools that keep your life standing strong. There's another reason. Your example matters. When one man steps up, others follow. I've seen whole friend groups decide to get tested after one brave guy posted his story. That's leadership. It's how communities heal and how stigma dies. You may never know whose life your courage will protect, but the ripple is real. If you're still holding back, remember this. Courage isn't loud. Sometimes it's just making the call, scheduling the test, or picking up the pill bottle again after missing a few doses. Those small, quiet acts are what save lives. And if you're already in treatment, share what's working for you. Tell another man that life after diagnosis isn't over. It's just guided by new rules. Rules that give you freedom instead of fear. For the men who feel stuck between silence and action, let me say this clearly. Your worth does not depend on your status. It depends on what you choose next. Don't let old stereotypes write your story. You are more than a label. You are a protector, a provider, and someone capable of building a legacy stronger than the fear that once held you back. Now let's bring this all together in a simple guide you can remember and share. If you ever feel overwhelmed, follow these steps. Notice the signs. Unusual fatigue, rapid weight change, fevers, or swollen glands. Don't ignore them. Get tested. Walgreens, CVS, Planned Parenthood, or local clinics can do it quickly and privately. Start treatment early. One pill a day can bring your viral load to undetectable. Protect your partner. Share facts, not fear. You = you keeps love safe. Stay consistent. Medication works best when it becomes part of your routine. Check in regularly. Keep appointments and stay updated with your provider. Support others. Talk about your experience. You never know who's listening. Those are the foundations every man should know. Keep them in your phone. Share them at work. Discuss them at church or community events. Knowledge is contagious in the best way possible. And here's what I ask from you as we move forward together. If this video reached you, taught you, or even just made you think, don't keep it to yourself. Like this content so the platform knows men care about their health. Comment one word that captures what you felt, maybe awareness, hope, or clarity. If something wasn't clear or could be stronger, type the number 0 so I can improve the next one. And subscribe not as a favor, but as a contribution. Each interaction helps these messages reach more people searching for light in their darkest moments. Together, those small actions create change far beyond this screen. That's how we turn information into transformation. One honest conversation, one shared story, one brave step at a time.